Good morning. We will go ahead and get started. My name is Trina Miller. I am with the Department for Public Health Prenatal Program, and this training is the Baby and Me Smoke Free with the script training for that program. This is for the FY17 MCH coordination package. We have our trainer today for scripts with us.
My name is Ellie Swizer. I'm from Louisville Metro Public Health and Wellness, and I'm a Scripps Master Trainer. And if you're asking, Scripps means Smoking Cessation and Reduction in Pregnancy Treatment Program for Scripps. And I'm going to give you a little background and information. What the heck? It didn't go.
If each of you can take and just type in the box, question box, your name just for our attendance purpose, would appreciate that.
Oh, okay. The purpose will introduce you to the Scripps program, and it's really, really important for pregnant moms because they're out there, they don't talk about them smoking, they're ashamed that they're smokers. So you need to let them know and discuss the dangers of smoking, the rates and trends of tobacco use, the purpose of Scripps, and we'll talk about the evidence base of Scripps. Active smoking during pregnancy is one of the most serious and preventable things that causes fetal and infant morbidity in the U.S. Low birth weights, SIDS, learning disabilities, all kinds of terrible things can happen when moms smoke. And we want to be able to have healthy moms. The toxins in cigarette smoke contain more than 7,000 chemicals and compounds, and at least 70 are known to cause cancer. There's urethanes, ammonia, arsenic, formaldehyde, hydrogen cyanide. Nicotine itself is a carcinogen, but it's also an insecticide. You can spray it on your crops and it will prevent the bugs from eating crops. And that is one of the most toxic substances known to man. Ammonia, you can clean your toilet with ammonia. You can use arsenic. If I had too much arsenic in my system, it would make my blood so thin that when I sneezed, my lungs could explode and rupture like a water balloon. Formaldehyde, they use that in morticians and embalming fluids to preserve bodies, and hydrogen cyanide is also in dirty bombs, chemical warfare, and they use that to kill whales. The adverse effects on maternal, fetal, and infant health are low birth weight, altered fetal development, impaired fetal growth, increased risks of SIDS and SUIDs, complications during pregnancy such as placenta abruption, placenta previa, decreased lung function of the baby. And when mom smokes, think about when you were outside as a little girl or a little boy and you were outside with the hose and you wanted the hose to stop so you could take a drink out of that hose. You would squeeze it and bend it in half, and that's what happens when you smoke. It puts all the plaque in your veins and arteries so that the blood can't go through. Healthy People 2020 wants to increase the number of women to quit smoking during the first trimester and remain quit for the duration of the pregnancy. And Maternal and Child Health wants to increase the number who report abstaining from cigarette smoke during pregnancy from 89.6 to 98.6. And it's ultimately imperative that the last trimester the moms are smoke-free. That is, if they get them to wean them down until the end of the third or the beginning of the third trimester, that's really a bonus. The risk during pregnancy for the CDC estimates around 10 to 15, but rates vary from survey to survey for the PRAMS. And SAMHSA talks about 15% of pregnant women reported smoking. Pregnant women who smoke, we would have them in Cooper-Clayton classes and freedom from smoking classes, and they feel ostracized even though everybody is addicted to smoking that's in the class. the pregnant women are ostracized for attending the class and being addicted. So they feel shamed into not attending a class. The higher pregnancy for younger women 15 to 20 smoke during pregnancy compared to women 25 and older, you can see that the status there, the younger girls are getting pregnant, they're in their childbearing years, and the lower the high school education, the lower the education, the more risk of pregnancy. The higher, the fewer. The smarter a mom gets at school, she knows how to plan her children and is more aware of all the health risks that are involved with a pregnancy. Medicaid covers 40% of the births in the U.S., and that's predominantly where they're going to be in your WIC clinics that you'll be seeing. If moms are connected with you from any of the managed care organizations, the MCOs, if they're referred to you, of course, those are Medicaid moms. 20% enrolled in Medicaid smoke during the pregnancy, and that's twice the national average. And in 2006, the smoking attributable cost per pregnant smoker is $881, and in 2015, it was $1,050. And the Affordable Care Act gives, an interesting thing is the Affordable Care Act gives daddies who have the Medicaid insurance to be able to get Nicoderm patches and nicotine products to help quit with the moms, and that'll help the moms have a higher success rate, because if nobody wants to hurt the other one for smoking in front of them. Smoking in pregnancy and reduction in pregnancy treatment. It's an integrated component of patient education and program for the prenatal care providers, and it also provides an in-depth look at evidence-based best practice. This is a best practice through the SAMHSA. Your program wants to be associated with a best practice, science-based, evidence-based best practice, and it educates the pregnant woman why she should quit and reduce her smoking for the health of her child and the health of herself. The components of the program, we've got the Commit to Quit Smoking video during and after pregnancy, establishing, counseling to establish a non-smoking home with the use of the Quit line, comprehensive counseling to quit or reduce smoking during pregnancy, and a pregnant woman's guide to quit smoking. That's a nice little book that's on a 6th grade level reading and will help them get through their quit. This is the book. It's a 31-page tailored guide that helps outline the self-evaluation process and helps moms build the smoking cessation program and makes them feel successful over a 7-day period. And again, I said it's written at a 5th and 6th grade reading level. The video was developed to enhance the patient's motivation to quit smoking, ensure patient exposure to recommended smoking cessation skills, and reduce counseling time. And it does significantly. It explains everything very succinctly, in very easy terms to adhere to, and it wouldn't be bad for the dads to be able to view that video if they were in the room as well when you showed it. It presents strong visual and personal and verbal messages about maternal, fetal, and infant risk. It's got the testimonials of pregnant moms who have quit smoking, and it demonstrates the behavior skills to quit smoking. For the counseling, you use the 5 A's. You ask about tobacco use. You advise the smoker to quit. That is the best thing that they can do for the health of themselves, their family, their baby. You assess their readiness to quit. You can use the trans-theoretical model of change on a scale of 1 to 10. Where are you on that readiness to quit? If you're at a 6, what can get you to 7? What could get you to 8 if you had this barrier removed or that barrier removed? And then you can use the assist with the quit attempt, where you can tell them to talk to their doctor about the possibility of using nicotine patches, nicotine lozenges, nicotine gum, or quit without anything using the Scripps program, and then you arrange for follow-up care and assure them, even though they might have a slip, that they should still continue to use the program. For follow-up, arrange the next appointment to follow up to reinforce the cessation message. You know, whether they get NRT from their doctor, you cannot give them any sort of nicotine products if you have them available in your health department. You have them use the Quit Line. The Quit Line gives money for phone calls to the pregnant moms. It's a wonderful program. It needs to be utilized. You can follow up with a phone call or a visit for a reinforcement call. You know, telling them that you're really proud of them for trying, you're doing a great thing, you're being a great mom, and then schedule a follow-up visit 30 to 45 days after the initial visit so you can see how they're doing. Commend them on doing a great job. The AHRQ guidelines. The U.S. Preventive Service Task Force, an agency for the healthcare research and quality, recommends person-to-person psychosocial interventions that exceed minimal advice to quit, and the 2008 guidelines cite the DVD and GAD as effective methods. It's an effective program. I've watched the moms who I've tried to counsel before I've utilized the Scripps program, and the moms after I've utilized the Scripps program, and it's a whole difference. It explains everything to them, what I might forget or what they might have questions about. It answers their questions before they really get started, and it's been demonstrated by the evaluation that they used all over the United States and abroad. These Scripps trials, they'll show you that the doctor that's in charge of this, Richard Windsor, has gone all over the U.S. Populations in metropolitan, statewide, counties, home-based clinics. It's working for them. They have a very good success rate. When Scripps was implemented in Alabama by nurses and social workers, 77% of the smokers agreed to be part of the program. 95% of the participants saw the video, 99% of the participants received the guide, and 97% of participants received counseling. 85% returned for the follow-up screening. And if they don't return the follow-up, call them on the phone, talk to them, text them. That's the big thing now. If you're not utilizing your cell phone for texting the moms, that's the way they all communicate. This is fun. Yeah. Module 2, implementation and procedures and intervention components in Scripps. We're going to discuss ways to screen for tobacco use, discuss the components of Scripps program, and conduct a Scripps intervention session. Again, with the 5 A's, ask about tobacco use, advise the tobacco user to quit, assess their readiness to quit, assist with the quit attempt, and arrange the follow-up care. What we're going to ask you, how this follows with your Baby and Me Smoke Free, you're asking different questions, but you're still using the 5 A's. You ask how many cigarettes they smoke a day. The questions are the same. You'll write the number down of how many cigarettes they smoke, and the cigarettes per day is the CPD on the screen. This is a module from Scripps. We're not using that verbatim. We're using the prenatal 5 A's intervention record, and you'll have the whether or not they're pregnant, the estimated due date, number of children, number of previous pregnancies. Do you smoke cigarettes, black and milds, electronic cigarettes? Have you smoked in the last 30 days? Right, and you know the list of them if you've got the sheet in front of you. But that's one of the, when you do your very first screening, that's the sheet that you follow and date and sign, and make sure even if they don't have a smoker in the home, if they're going to go, if the moms are going to go to grandma's house or auntie's house or somebody's house that has a smoker, make sure they know about what happens with secondhand smoke. Hand out that sheet that accompanies that. please. The routine client assessment protocol needs to be implemented as part of the routine prenatal care. You should do a full screening at the onset of care and at least once more during the pregnancy. The protocols for Baby and Me Smoke-Free are each trimester. You do an initial intervention, and then you do visits on each trimester, and then one again through the 4th trimester. I realize that's not always able to do because some women don't realize they're pregnant till their 2nd trimester, so you do the best you can in each trimester. You assess the tobacco use by the pregnant woman should include a biochemical test to produce an accurate data about the smoking status. That is use of the CO monitor, oxide monitor, and that is pretty accurate as long as you keep your equipment in clean working order and have plenty of mouthpieces and the special wipes for them. And an earlier cessation intervention occurs in pregnancy, the more time she has to quit. The more you can talk to her, the statistics show, the better she's going to do. The routine client assessment is what their current smoking status is, the number of cigarettes per day, how they're getting environmental tobacco smoke exposure. That means whether it's secondhand smoke. And you realize secondhand smoke, firsthand smoke comes from the smoker. Secondhand smoke is exhaled by the smoker. It comes off the burning end of a cigarette. It floats in the air for about 4 hours, and then it sticks to everything in the house, the carpet, the curtains, the couches, the furniture, tabletops, everything. And that sticky stuff that's there is considered third-hand smoke. And so you have to talk to the moms about that. Even somebody that's smoking outside needs to use a smoking jacket and keep the third-hand smoke away from the baby. Also, the level addiction. Normally, the level addiction is higher the earlier the person started to smoke. If they started smoking in their 10, 12, 13 years old, their addiction level is going to be higher than somebody that started smoking at 17 or as an adult. And then their personal beliefs about the dangers of tobacco. You'll hear a lot of stories of, my mom smoked with me and I turned out just fine. There's a lot of things that they might know that happen with them biologically, physiologically, and see that they really want to quit. Don't pressure them to quit. Just give them the good information. No. If you haven't got your CO monitor, I will show you in a little bit how to use it. Whatever you do, do not use hand sanitizer on these monitors. It will ruin them immediately. And the reason that you do use the biochemical test, you need to establish a baseline. And what you're testing for is carbon monoxide, not carbon dioxide that you exhale, carbon monoxide. Carbon monoxide is the same thing that would come out of the end of a tailpipe from a car. They always tell you don't use a lawnmower when the garage is closed. Don't leave your car running when the garage is closed. In the really cold months, don't run your kerosene heater with everything closed in the house. That's the carbon monoxide buildup. It's a silent, deadly killer that was odorless and will put you down. And that's the part with the carbon monoxide test, is when a person smokes, their carbon monoxide levels will be raised. And it's a baseline for this other. Okay, we've just got, this is some of the data from Dr. Windsor when he worked in Birmingham in the year. And what it is, the non-disclosure rate from the people that smoke, it's not accurate. Many, many times the moms will not report that they are smokers when they really are. They, I don't know if it's shame. I don't know if it's privacy. They do not want to disclose that they're smokers. So using the carbon monoxide monitor would show you that they really are using, or it can show that they're exposed to secondhand smoke in their home. And a third thing could be if their levels are high when you do the monitor, You can see if somebody's got a gas leak in their house, if their furnace is messed up, if their heater is messed up, the water heater is messed up. We found that in people when we did carbon monoxide testing in the fair. Okay. Hi, everybody. I want to let you know about the monitor. This is a Smokalizer monitor that I'm showing you right here. You need to make sure that you have an extra pack of batteries with you. It's been in the car, it's cold, it'll still work. You have to hold the button in and turn it on. There it went. You can see, where'd it go? As it's kicking on. Then I'm going to take this mouthpiece like this. It's a mouthpiece with a flat end on the top and a little room for a straw at the bottom. I don't know if you can see how that goes. Then a straw. It comes in a little paper with your D mouthpiece. We'll unwrap the straw. Make sure that you've cleaned your hands before you do this on somebody. You put the straw in and insert it like that, and then it's ready. You use the monitor. You have to double click to move the monitor. You'll go to where the X, double click, and you'll go to where it shows the face. I don't know, can you see the face? It'll show a little face on there, and the hand points to the face. At the very top of the monitor, there's a number 1 with a man on it, and there's a number 2 that has a child on it. You want to do adult to make sure yours is on number 1 for a man. So what we'll have the participants do is you have them let out all their air. Take a big breath in, hold their breath for 15 seconds, and click. 1, 2, 3, 4. Come on. There it goes. It'll click down. You'll see a little clock on the front of the monitor. It clicks down. You're still holding your breath. It'll beep 2 times short and then a long one, and then you blow in the monitor. If they're a smoker, mine doesn't show but a 4 or under, depending on if I was outside. A smoker can go anywhere above 4. Somebody that is exposed to secondhand smoke in the home, he says an 8 or lower, says that they've been exposed to secondhand smoke, and a smoker will register higher. I've noticed some of my moms don't smoke on the days that I'm supposed to visit with them, so that it'll kind of change their monitor. It shows up for about 48 hours, so you'll be able to see whether or not they've been around smoke. And that's what you log on the sheet that we were just talking about, the prenatal, the 5A sheet. You use that where it says, where is that one? It'll talk about the cottoning screening. Where is that? CO levels with the Pico monitor, and then you write that in there. You need, every time you visit with your moms, you need to take their carbon monoxide readings. You want to put that up now. To turn it off, you hold the button down, and it turns off. You throw the mouthpiece away, you pull out the D piece and put it back in your case. It also comes with a DVD that you can look onto your computer, and it'll show you the blows that you got if your computer is right back where you'll be sitting and showing your DVD. That would be a wonderful thing. Mine is not. I go out into homes. It comes with the DVD to show you how to use it. It also has a reading to show you the levels of smoking and what goes to dangerous. You'll notice the lights on the sides. It goes from green to yellow to red on the monitor itself. When it goes to red, you know that is a really smoky house. That's dangerous to the fetus and the mom. They don't need to be around it. It causes SIDS, and what we found out is that 8 out of 10 babies that die from SIDS are tobacco related, and so we don't want that. We want fat, healthy babies and healthy moms. And there's also a cord that can connect your CO monitor to your computer so you can verify if there's anything going on with it. It should also come with a can of compressed air to show you it's just air. It's not oxygen or anything, that you can reload and recalibrate your monitor. If you need help with that, Bedfont or whomever the Cadiva monitors will help you with that. The tobacco screening form. Take turns with your partner now and practice using the tobacco screening form and practice using the CO breath monitor. We can take a little break right now so you all can practice, and we'll be back in about how many minutes? Hey everybody, we're back. I wanted to see how y'all did with trying the CO monitor. If you don't have one, just play along. Again, with the 5 A's, ask about, at every visit, ask about tobacco use. Even if you've seen them before, ask again. Advise them to quit. They need to hear it many, many times, some folks. Assess their readiness to quit. Assist with the quit attempt and arrange the follow-up care. Pregnant Woman's Guide to Quit Smoking are the components. The DVD, Commit to Quit Smoking During and After Pregnancy. Counseling to establish a non-smoking home with use of the quit line, and a comprehensive counseling to quit or reduce smoking during pregnancy are the components of the Scripps program. Their procedures do not coincide with ours yet. We are doing both programs together. In a little while I'll show you what you exactly need to do, but this is the program for Scripps, and you've had the little short abbreviated version. Well, actually 4 days. So you document how ready they are to quit, and you're making sure that you provide strong, clear messages about risk of smoking to the mother and the fetus. And even if the moms are exposed to secondhand smoke with the daddy or the grandma, explain to those folks as well. You know, it's okay to have other people sit in on your conversation so that they're aware of the risk as well. And provide clear, strong, and personal advice to quit and stay quit. A person at $4.50 a day, a person who smokes for a year can save $1,642 just by not smoking. And I don't know any pregnant woman on this earth that couldn't spend that on their baby. With the assist, review the cessation skills in the video and guide, and sign an agreement to use the guide. That agreement is within the guide that you're going to have the little booklets. Make sure that they know that you're confident about using the guide and the methods that will help them quit. You know that this tool is going to help them. This is an evidence-based best practice, and encourage the family and the patient to seek social support and family support. So the more effort that, you know, people that support them, the higher they're going to be on their quit. They'll be more successful. Advise patients to stop secondhand smoke. That's ETS, is secondhand smoke exposure, at the home, car, and any social exposure. And we talk about even walking into one of the big box stores, what's the first thing that you smell? And when the kids walk into Walmart, when we're doing child presentations, and say, what do you smell when you walk into Walmart? And they say chicken and cigarette smoke. So even walking through the smoke at a big box store can hurt the baby. We want to have no secondhand smoke exposure at all. And remind patients of the patient counseling for the Scripps program. We're going to use the DVD and the guide to help the mom find the motivation to quit smoking and provide her with the best practice and tools and skills to be successful. The video, the Commit to Quit video, was developed to enhance the patient's motivation to quit smoking, ensure the patient exposed to recommended smoking cessation skills, and significantly reduce counseling time. In addition to this video, make sure the moms, I can't say it enough, are utilizing the 1-800-QUIT-NOW pregnancy protocols. You can utilize a Quitline fax referral form, is that in your all's paperwork? To utilize that, and there's a really cool little trick I'll talk about in a little while to put your name on that PDF so that when you give it to your moms, it'll always come back to you. The Quitline will let you know when they've received your fax and whatever happens with that fax, whether the mom rejected it, whether they couldn't get a hold of her, or whether she accepted the assistance. You can also do one on the dads or the grandma. And the Quitline will give you free NRT to folks without insurance, but they give the moms free money, $1 or $5 gift cards for every phone call that they take, up to 5 phone calls. They'll still get more phone calls, but they only get up to $25. And then once the baby is born, they get $10 phone calls up to $40 worth. So they can get a total of $65 from the Quitline. And it's just a good bet for you to have as many ways to help her as you can. We're going to do the video.
I was mostly afraid. I was worried that I wasn't going to be able to stop, and I was concerned that something bad would happen to the baby.
If you're going to quit, do it when you're pregnant. It's the best time.
Quitting smoking can be one of the hardest things you will ever try to do, but it can also be the best thing you will ever do because it's good for you and your baby. You are taking the first step by using this book, A Pregnant Woman's Guide to Quit Smoking. Here's why quitting is so important. As your baby grows inside you, it gets all of its food and oxygen from you through the umbilical cord. If you smoke, nicotine from the cigarette narrows your blood vessels and your baby gets less blood, food, and oxygen. The carbon monoxide in your cigarettes, that's the same poison in the exhaust from a car's engine, cuts down on the baby's air as well. Also, as you continue to smoke, the umbilical cord narrows and changes, keeping your baby from getting all it needs to develop normally. This can lead to your baby being born early and too small to breathe on its own. Your baby may have to stay in the hospital for many weeks, or worse, you could have a miscarriage. When babies are born early, even after they come home, they can be sick for a long time and have problems. Other babies born to mothers who smoke may seem to be healthy at first, but are often sicker. Exposure to cigarette smoke can cause them to have more ear infections, allergies, and breathing problems, needing to see a doctor more often and costing more money.
Well, I have a 2-year-old. Unfortunately, he was born with asthma, so I feel like that's my fault that he has that. And every day, I just blame myself for it. So I'm trying to prevent that with this one.
Many people know of someone who smoked while pregnant and the baby seems fine, but the point is, pregnant smokers are running a real risk. No mother wants to take chances with her baby's health. You can stop smoking in just 7 days. This guide can show you how. If you follow it carefully, step by step, every day for 7 days, the guide will teach you many things to help. The first step is to set your quit date. Right now it may not seem possible, but in 7 days you can be back in control of your body and the health of your baby. You'll also use signs cut from your guide to paste up around your home to help you not to smoke.
Well, I decided to cut them out, place them places I look at frequently, the refrigerator, my bathroom, my bedroom. But then I thought that was kind of silly. But I felt that if I had a reminder every day, that it would help me stop smoking cigarettes.
On day 2, you'll fill out a smoking diary. It's a record of your smoking habits over a few days' time, which helps you learn how and why you smoke. It could be almost anything, but many situations and places make us want to smoke. We need to find out what these are and then try to avoid them. Many times we don't decide if we really want a cigarette, we just smoke automatically.
Alcohol is a huge trigger for me. If I drink, I want to smoke, and it's always been that way. So basically, I just decided to stay away from alcohol, and therefore I would stay away from cigarettes.
I noticed that I smoked a lot when I sat down and watched TV. So, the time just slipped by, and so did those cigarettes. So I just stopped watching so much TV, and I started reading more.
On day 2, you'll also make a yuck jar, some water, broken cigarettes, and all of your cigarette butts for the rest of the week.
I do this deep breathing exercise where I close my eyes, and when I breathe in, I think 1. And when I breathe out, I think too. And I just do that until I'm completely relaxed.
The guide will teach you deep breathing to relax yourself so you can take a breath anytime you need it, when you feel tense and when you feel the urge to smoke. On the following days, you'll continue your smoking diary and choose a stop smoking buddy, someone who cares about you, a friend or relative who will be there for you if you need help resisting the urge to smoke.
Well, I had a friend who really helped me out. You know, when everything would get frustrating and I wanted to smoke a cigarette, I could just pick up the phone and call her. One day I came home from work, I had a long day, very frustrated. The house wasn't clean, my husband was just sitting there, hadn't looked for a job all day. I was just like so frustrated. I wanted to pick up a cigarette and smoke. I picked up the phone, called my friend. She told me to look around, look at all my signs, and everything would be okay.
My mother used to smoke a lot, so she understood what I was going through. She'd say, go eat a carrot stick, just don't smoke. So I did. I ate a carrot stick. I remember one night I called her at 3 in the morning and I'd had a huge argument with my husband and things were really hard and I was crying and she said, the most important thing right now is don't smoke.
The guide will also teach you how to follow a smoking schedule. You'll plan to smoke only at specific times, cutting down each day. If you miss a scheduled time for a cigarette, you'll have to skip it and not save it for later. For the rest of the 7 days, you'll only smoke those cigarettes you have scheduled at the times you have planned, with fewer cigarettes each day until your quit day. You'll also learn smoke tasting, which is a way to make cigarette smoke taste bad to you. You swirl the smoke around in your mouth and hold it in. It won't be much fun, but it will help you quit smoking. And you'll also plan fun things to do to help you fight the urge, so you'll be prepared when the craving comes. Take a walk, watch TV, read a magazine, chew gum, plastic straws, or fruits and vegetables. Take a nap, go out to eat. Treat yourself to whatever you need to do to keep your mind off smoking and help you not light up.
Well, while I was sitting there, you know, the time was going by, I was wondering what could I do to stop smoking cigarettes. Telling myself not to pick up a cigarette every 20 minutes just wasn't working. So I decided to pick up exercising. For one, it's a healthy way, you know, to get by smoking. And for two, after you're finished, you really don't want to smoke a cigarette. It would just defeat the whole purpose of your exercising.
My family situation was very, very stressful when I was pregnant. And I found that one thing I really enjoyed was walking. I'd go for a walk instead of smoking. And that was really, really helpful.
The guide will help you plan some activities that will relax you so you can cut down on the stress that keeps you lighting up. As you use the guide, following all it tells you to do, one of the last things you'll do before you quit is to plan a reward for quitting, something to keep you going and stay quit. You'll also start a bank to save the money you would have spent on cigarettes. It's amazing how much money you can save in 6 months by not smoking. This is money you should use to treat yourself or your baby to something special.
I decided to, you know, create a jar and decided to put all my money into that jar that I would be spending on cigarettes a day. So at the end of that month, me and my kids went through the jar and I couldn't believe how much money I spent a month on cigarettes.
I decided when I stopped smoking that I would take the money that I spent every day on cigarettes and put it in my little savings box. And then when I had the baby, if I had stayed quit, I would take that money and buy her something really nice.
If you follow all the activities in the guide, you'll be an ex-smoker in 7 days, and your baby's not the only one who will benefit. Your breath, teeth, and gums will be healthier. Your skin color and texture will be better, and most important, you'll greatly reduce your chances of heart disease and cancer.
I felt a lot better. My skin looks better, my teeth are whiter, I don't smell like cigarettes. My kids are so much happier now that I'm not smoking. I'm so proud of myself. I never thought I'd be able to do it.
Once you've quit, the guide will help you stay a non-smoker as the nicotine leaves your body and your baby's blood. It will also help you remind others not to smoke around you. This is very important because when you're in a smoke-filled room, your baby gets less oxygen. So even if you quit, secondhand smoke from those around you can still hurt your baby.
It was really, really rough being around my friends at first while they were smoking. The smell was just incredibly tempting, and it was just really stressful knowing that I could start smoking again at any minute.
I'm not pregnant, but I didn't start back when I had the baby because, well, she's still in my life. She's still in my home. And I didn't see the point in subjecting her to the smoke now. And I didn't want her to see me smoking. I don't want her to think it's okay, so that when she's old enough, she'll smoke too.
When you quit smoking, you change not only your life, but also the lives of those around you. By quitting smoking, you can make the commitment to live in a healthy, smoke-free home. Quitting smoking is not easy, but the important things in life never are. The Pregnant Women's Guide to Quit Smoking will help you take an important first step to keeping your baby healthy its whole life, and hopefully help you stay quit from smoking, or at least cut down a lot while you're pregnant. Don't be discouraged if you slip. Read the guide again. Even cutting down helps. You can take control of your health and your baby's health. Sign the contract to quit now. Your baby's future depends on you.
Okay, we are going to take a look briefly at a document. I did send in an email, and you have received prior this will be the guidelines and counseling for manual for prenatal care. And if you receive it in the email, you can look that over, or from the other email, you should have received this, and it should be on your Jump Drive. This corresponds with the workbook and the video, and it just gives further detail and information about the different steps that you can do, like the yuck jar they mentioned, other items in there that you can utilize for each day. And it kind of goes through the segments of each day and gives you some questions, some examples, so it can help with the conversation flow that you may want to have with your visits with the women.
Let me tell you a couple things too. When you're working with the moms and they put their money away from their cigarettes, have them pay themselves first so they can really see how much money is left. And watch out for, make sure to tell them if they vomit that day, not to try the yuck jar again, because they might get sick. Mommies have the super smell power. That's their superpower when they're pregnant. So if they get sick from smelling the yuck jar, tell them to try it again the next day. And the smoking buddy needs to be a smoke-free person that encourages them as well. You arrange the schedule the next visit for your patient. You can call them, you can talk to them, make sure you refer them to the quit line. There's also text for baby text messages and smoke-free mom, and recommend pharmacotherapy. That's the Nicoderm CQ patches or Nicoderm patches, lozenges, and gum. And then you do a follow-up assessment 30 to 45 days after the initial visit. Make sure and do the carbon monoxide screening, and use the follow-up form from your 5-ACE form to reassess their smoking status to see where they are, if they've stayed quit or reduced or whatever they're doing. Do their CO screening, and it'll show how they're doing with their CO screening, and decide who's going to conduct the follow-up and where it will happen. And you can see.
We're just going to change now over. This will be your
That's how to-
other PowerPoint that you should have received.
I know we've given you a lot of information, and what I want to show you is what you need to do and how the program really works. It's all done abstractly, and you might feel a little overwhelmed, and I felt like that in the beginning, but now it's gotten a lot easier once I figured all this stuff out. You need to design your referral form that you are going to leave on sites where people will be referring to you with the name of the mom, 2 phone numbers, address, the best time to call. Can they leave a message? If they are able to text message, which is the way they all want to go, make sure you get a signature with authorization to call so they don't say that you're trying to sell them something. Make sure the date signed and the date received are 2 different things. When I get referrals sometimes. And we're back. On your referral, make sure that we'll start all over again. Make sure you get the mom's name, 2 phone numbers because they are very transient and they don't always have the same phone number, the address that they will be at so you can put things in the mail to them, the best time to call, morning and noon, afternoon, evening, weekends. You know, they might say weekends, but you got to find a time during the week. Can you leave a message? Can we text? And that is the way the moms do communicate now. Make sure and get a signature with authorization to call, the date that it's signed, and the date you receive it. The reason I say the date that you receive it, because if you get your referrals from other agencies, the date that it's signed and the date it's received could be 2 different dates. And get the name of the number of the person that's referring the mom and any other information that you can get besides the due date of the baby. Make sure to collaborate with WIC. WIC has got so many moms that are smokers. It's wonderful to have a client base so close, and they're right there. You can access them, you know, with a captive audience. Also, bump up with your WIC neighbors because you can get access to their databases to be able to pull moms off of there, and you'll know when they're coming in for their WIC visits, and you can schedule that for a meeting as well. Some agencies you can partner with are birthing hospitals, WIC offices, housing corporations, you know, the apartments, we have Metro Housing Authority, we have Metro Housing Coalition, the OBGYN offices, Head Start referrals because they've always got pregnant moms and moms with newborns, breastfeeding groups, pediatrics, March of Dimes, Planned Parenthoods, HANDS, Metro United Way, the homeless organizations, your regional prevention center and Kids Now, your managed care organizations or MCOs, YMCA. We have schools for pregnant teenagers in Louisville. I'm not sure that you all have that, but I'm sure there are pregnant teens within the schools. Your senators and your council people, they have newsletters that they send out. And the 4Cs, Community Coordinated Child Care, if y'all have something like that in your area, it would be a very nice place to get referrals. These are the handouts that you use for Baby and Me and Smoke Free. This is a brief list of everything that you'll need to keep on hand with you, and I've broken it down so it looks kind of overwhelming right here. So I've broken it down. This is what you would leave with the moms, dads, and grandmas, aunties, uncles, whomever, where the baby would come home to. You need to leave the benefits of quitting sheet with them, right ideas to help you quit, the pregnancy and postpartum protocol fact sheet, what's in a cigarette and what's in an e-cigarette, secondhand smoke fact sheet, the asthma fact sheet, and the SIDS fact sheet. I know the Baby and Me Smoke Free program says to utilize the different sheets for different visits, right, as a suggestion, but I would suggest give them all the paperwork at the same time because a lot of the moms have pregnancy brain, and I tell them to leave them next to the bathroom, so that can be the library, and you can sit and read while you're taking care of other things. And that's really, you might laugh telling people to put it there, but that's where it gets read. And I drop those off at every visit. As a matter of fact, I have them all run together, stapled, and I leave that with every visit. The way to spread the word, get the word out, make sure you create a referral sheet specific to you, to your person, or to whomever is going to be contacting the moms. Make sure when you do your brochure and you add the financial incentives to the brochure and add your contact information so that people can get hold of you. You can make posters for your services, get out and talk to people, speak at meetings, do whatever you need to do to get referrals so that you have plenty of work to keep you busy. And believe me, if the referrals start rolling in, you will be busy. For you to keep with yourself, you need to have the referral that you received with all the demographic information on it. The service record, I have created a service record that I stapled to the completed referral so that I can log when the times that I've called, the days that I've called. I call everybody at least a minimum of 3 times, usually 4 times. I call and text so that if they haven't answered by then I put them in a file and I file them away. I used to try longer, but I got so backlogged I didn't do that anymore. If you bump up and make friends with WIC, you might be able to print labels so the sheets don't get mixed up. You've got multiple sheets on these moms, and believe me, when you get enough going together, they can get mixed up, so you don't want that. So if you can make labels from the WIC clinic if you have your own little zebra printer or have somebody there that can print them up for you. You also need the 5A's intervention record that you use at every visit. And the first wellness encounter, it's 2 sheets, the bubble sheets with the front and back that have the social interaction monitor, the domestic violence, and the Edinburgh for perinatal depression. And you do that at the beginning, and we've been suggested by our epidemiologist to do that at the last encounter as well, so you have really good data together. In the beginning, you'll need the scoring cheat sheet. Once you score about 10 or 15 of them, you don't need the cheat sheet anymore. The reason you need the cheat sheet is because some of the scoring goes backwards and some of it goes forwards. And what I ended up doing was, those sheet protectors that are clear, I would slide my bubble sheet into a sheet protector that had the little cheat sheet written on it so I could score my sheets without having to look at something else and take another sheet out. It just made it easier for me. You'll have your own way of doing things that makes it easier for you. My way doesn't mean it's the right way. It's just one way. And I also make a folder for each person. And I've also created a mailer to send to the moms. If I can't get a hold of them on the 3rd time, a lot of times I'll send a mailer out and try to contact them again after that to ask them to call me. Make sure with you always keep a resource list that are relevant services in the service area. That's your homeless, your where to get food, where to get money for rent. Just access all kinds of services because you're going to get asked those questions by your moms once you have established some rapport with them. You can also go to the AuntBertha.com. This is a really great site. It seems to be national. You can go in and put your zip code and play with it. Aunt Bertha is a really nice tool to be able to use for housing, food, all kinds of services. There's also the iCarol info that goes through the Metro United Way. That's their public resource directory. iCarol is great. It'll do the same thing. I think it has even more than Aunt Bertha, so that's a nice tool for Metro United Way. We also have referrals that I keep on hand for mental health counseling. If the Edinburgh, which is the perinatal depression screening, Also says, if they score a 10 or more, that means that they need mental health counseling. And I know 7 counties, which is now Cornerstone, will take that, and they do home visits. There's a very last question on the end of the Edinburgh that says, I want to hurt myself. If they say, I want to hurt myself, do not leave them alone, ever. You stay with them until somebody comes to help take care of them, or you call an ambulance and you put them in the hospital, or whatever the protocols are within your department, but do not leave that person alone if they want to hurt themselves. I also keep HANDS referrals with me, extra Quitline fax referral forms, Quitline pads that I can leave anywhere. The state has tons and tons of them. They'd be happy to send them to you. As a matter of fact, I have a zillion in Louisville. You're welcome to pick them up if you're there for a meeting. Extra brochures of the Mommy or Baby and Me Smoke-Free program. Change the back of the program to have your name and your contact information on there. And then we have Healthy Start with our program. Healthy Start only hits a few zip codes in the Louisville area, so that's just a really nice resource for us. And this is my contact information. If you have any questions that maybe Trina can't answer, I'm sure she'll know most everything, but if there's something that you need that we have, or you need a copy of my referral to utilize for yourselves with our information on there, I'll be happy to share it with you at Louisville. Anything else that you can think of?
Now, I think that we have our presentation portion done. I'm just checking to make sure there are any questions that are listed. If you did have a question, we missed it, or you have a question at a later point, feel free to email me. And also, Ellie has a great source of information from doing this program for the past couple of years, and also through the script training. Do make sure that you have your DVD and your workbooks. Make sure that you have your Smokalizer Pico monitor. If you have any questions, let me know. Thank you very much.